Jamie Mey. I'm the owner of JMZ Physical Therapy. I started up my LLC back in 2021, but I would say my business started to really thrive about a year ago now, when I quit my full-time job to pursue this and do my independent work. I was a physical therapist for Elite Physical Therapy. I think they have about 10 different clinics in Rhode Island. As a physical therapist, we assess, we diagnose, we treat. A lot of what I do is primarily manual therapy, body work, but specifically pelvic alignment and dry needling. So within manual therapy, we can do cupping, Graston, we're doing pelvic alignment, we're doing manual lumbar traction, joint mobilizations, but I specifically, I would say my niche is primarily dry needling in particular. Dry needling, first, one of the biggest questions I get is dry needling the same thing as acupuncture, or people just assume it is. I think the biggest thing I have to explain is that they are two entirely different things. It is a very similar technique in a sense where you're using a needle and you're inserting a needle into someone's body, but totally different in regards to the theory behind how it works and then the application of the technique. So acupuncture is more, you're more targeting energy flow, chi throughout the body by targeting meridian lines. Whereas with dry needling, your job is to find the hyper irritable spots in the top bands and the trigger points throughout the muscle tissue. And once you find those and you insert the needle a little bit deeper than acupuncture into the muscle spasm itself, it creates a spinal cord reflex, and that releases the muscle spasm or the muscle being stuck in a contracted phase. It basically brings it back to its resting length. It's called dry because, dry needling stems back to, I think it was in the 1940s, a lady named Jeanette Travell. She was actually the physician for the president at the time, Kennedy. So she was the White House physician. She did a lot of trigger point injections. So I think back even in the 1940s, they started to realize it wasn't necessarily just the injection itself that was alleviating people's pain. It was just strictly the needle being inserted into the body, especially in a muscle spasm. But it didn't take until 1979 or 1980 where it started to become in the scope of physical therapy. But it's called dry because we're not injecting anything. It's strictly just the needle insertion itself, and that creates the response. There's a lot of different theories there's a few different theories as to how dry needling works. We don't actually know exactly what makes dry needling work. But we do know it does based on the fact that there's been numerous studies that have shown, taking imaging at a microscopic level, we can see the change in tissue density, the change in tissue health. The muscle, instead of being stuck in a contracted phase, it's back to its resting length. Fiber orientation is much more realigned. There's better blood flow to the tissue. So we know it works, but we just don't know how. So I graduated in 2015, and the company I first worked for, Elite Physical Therapy, I was very fortunate because when I first graduated, they were the first company in Rhode Island to have an organization actually come through and train a bunch of our clinicians. I think I begged to get into the course, but they let me in. And so I was very fortunate because I got to start it at a very young age in my career. So as I was just still kind of fine-tuning my style of physical therapy, I just got to incorporate it right away. So that's where it all started. They actually had a company come through and train for 3 different weekends. So we all became, level 3 certified within a couple months, which was nice. But yeah, I just started to use it every day, a lot more than my peers. I don't know if I just had like an innate sense of like comfort doing it or confidence doing it, but I think the biggest thing is I found that it worked so well that I couldn't not use it. I was seeing such a drastic relief in people coming in the door And so I just kept using it and pushing it on people way more than other people did. I think people come to see me because I get two different types of people. I think that my biggest population is I get my fitness fanatics, people who just want to stay active and really want to stay on top of their impairments and their symptoms. When something gets tight, instead of letting it linger or becoming a bigger injury or bigger problem, they want to really address it sooner, that they can continue just to maintain their daily boot camp classes and CrossFit classes. And so that's one patient population I have, but then I just have people that are honestly in enough pain where they will try anything. So needling typically is not something that people hear and want to run towards, but when you're in enough pain, you'll try anything. And so I think I won a lot of people over who were in that much pain, because with dry needling as my primary technique, I'm able to get relief very fast for people. I think there's a lot of different trigger point techniques out there. I mean, even just massage therapy, manual trigger point relief. You can use cupping, grasping. There's a lot of different manual techniques, but dry needling just works fast. It is efficient. You know, I can maybe do 3 or 4 needles in someone and give them almost complete relief if I'm really targeting the right areas. So in regards to frequency or consistency of visits, how often people come in, it really depends on the person. Everyone has an individual problem, and it's very specific to their condition. Is it acute? Is it chronic? What are their goals? Is there a marathon coming up that they're trying to prepare for? Is it just an acute injury that within a couple sessions I'm able to clear it up and they don't have to come back for months at a time? It really depends on what their goal is, what their intentions are. I have quite a few patients who just like to use this as their maintenance, which I love. I think that massage therapy has always kind of been seen as like a source of maintenance, an approach for people, but it's as a cash-based provider, I think it's nice for people to be able to, as long as they respond really well to the manual therapy and the dry needling, to be able to use this as a source of maintenance for them. Does dry needling hurt? The answer is yes, it definitely does. I wouldn't say people rush through the door to come see me because it's fun, but it works. It definitely feels different than you would, say, a needle pin prick. You don't necessarily feel the needle, in a sense, the pricking of a needle. What you do feel is your body's response to the needle. So you feel the aching, you feel the muscular twitch response. You can sometimes feel referred pain. So the interesting thing with dry needling is that I'm targeting trigger points. So trigger points have the capacity to actually refer to other areas of the body. So I could have a trigger point in my infraspinatus, which is the muscle on the back of my shoulder blade. And if I have enough trigger points there that are active, then they can actually refer to the front of my shoulder, to my elbow, or to even my wrist. So sometimes that's where the fun part for me, because I have to really figure out where the source of the pain is, even though your pain might be of a distant area. One of the most rewarding parts of first of all, I get to do this in my hometown. So not only do I have my fitness fanatics and people who are just in a lot of pain, but I also treat a lot of like my family and friends. So that's super rewarding as well. But you know, I do see quite a few people that are at their all-time worst because pain is emotional. It takes a toll on you. You know, I have people walking in the door with 10 out of 10 pain, shooting down the leg. So to be able to just get them to hop up on the table and within a 45-minute to an hour treatment session, be able to really alleviate that pain within one session alone and have them walk out the door with a smile on their face is incredible. With a lot of the techniques I do, I think another important thing in regards to what we do as physical therapists is it's important to truly diagnose things the right way. So even if someone were to come in with knee pain, I might be looking at their low back as a source of the knee pain, maybe a pelvic alignment issue or a pelvic obliquity issue at the hips, potentially a ankle-foot problem that's causing a mechanical issue at the knee. So I think diagnostics is a huge piece of it, and I'm fortunate to be able to really have the time, being a cash-based provider, just to be able to spend the time assessing everything efficiently, looking at the above and below, just adjacent joints to figure out what the true problem is. And dry needling also gives me the ability to diagnose things quicker, because not only is it a treatment, but as I'm treating, it's also an assessment in a way. If I were to stick a needle into a muscle and get zero response, then I know I'm not properly diagnosing someone's symptoms or someone's pain. So to be able to really see where I'm getting a response. Am I getting a response at the knee from the knee, or am I getting it from the lower back? It's a nice diagnostic tool versus going to get an MRI or an X-ray or any of the other things. Being able to have my own business and really provide the type of care, quality care that I want. I never knew how it was possible. I never knew this was, I never knew this was doable. And it kind of happened organically. I was working for many different outpatient companies, and I always had a side hustle. I was always working at a CrossFit gym or a boot camp gym, and always involved in the community outside of just my outpatient clinic. But it kind of, the second I moved back home, it just kind of blew up, just via word of mouth. And I have to think a lot of my referral sources, it's a little different from getting referral sources from doctors. Most of my referral sources are actually just business owners on the island, chiropractors in town, other massage therapists, personal trainers in town that want to keep their clients healthy. So it's just been rewarding to be able to provide services where I grew up, where I was born and raised, and it makes it that much more rewarding. If you are in pain, there's a lot of options out there. You just have to find the right fit, whether it's chiropractic care, massage therapy, physical therapy, acupuncture. I have a lot of patients who do a lot at once. I have a lot of patients who we call it their wellness team, and they might be seeing a nutritionist, the chiropractor down the road, and then someone over at the Pilates studio. So you kind of have to find your fit and figure out what works best for you. And I do think that it's different for everybody depending on what they're struggling with. Another thing too is I think that there's a misunderstanding that you have to get a diagnosis. If you're in pain, you need to figure out exactly what it is with a specific diagnosis. And I find that not always to be the case here. Sometimes I purposely tell my patients that I'm actually not going to diagnose you. I'm going to just tell you what your impairments are. So your pain is here, and I'm finding that you have a lack of range of motion here, weakness here, maybe a pelvic obliquity, and maybe a mechanical flaw when you squat. But I'm not going to necessarily say this is your specific diagnosis. I think we need to kind of veer away from that in the world of physical therapy and just in general, because you don't have to have something structurally wrong to have pain. You can have pain strictly off of just a buildup of trigger points, and a buildup of trigger points can be purely related to occupational demands, poor posture, overuse, if you like to play golf and tennis too much and you're not doing the things on the side to really reverse those impairments. So that's another thing that I think is important. All my patients are strictly word of mouth. I do not do much marketing, and that's been a beautiful thing because majority of my referral sources have been referrals from family, friends, and people I already treat. So I have had the opportunity to have a fantastic group of patients who I have a great relationship with, and with one-on-one care in the physical therapy setting, you have the time to really build a better relationship with your patients so that they're feeling more confident, more comfortable, they're getting the attention that they need. So that's been incredible as well. And all in all, I'm just super fortunate to have a job that I actually wake up loving to go to every single day.